Hello everyone, welcome back to my channel. Today we will be discussing on NHS interview tips and how to crack it in the first attempt itself. I have tried to include all the points that were helpful in my case, and I'm hoping that this will be a guide for you for your future interviews. So you have got an interview call. Congratulations for that, because it takes a huge number of applications as well as rejections to finally land an interview. The first thing to do once you get an interview mail is to confirm the slot, as your suitable timings may be taken up very quickly. So try to confirm the slot as soon as possible. Usually, we get the interview mail 2 to 3 weeks before the interview, though sometimes it may be short notice. All the correspondence are through mail, so keep checking your mail regularly. And nowadays, most interviews are remote. Once you have booked the interview slot, make necessary changes in your calendar and arrangements in your workplace. Remember, the time given in the interview mail is the UK time, and check the interview panel as well. Usually, they will be giving who all will be taking your interview, like the managers or consultants. I would go to their LinkedIn profile and check in which field they are more specializing in so that we can prepare the interview in a similar manner. So, it's your interview day. Always prepare well for the interview, even if it is for a post that is a very junior one. I would prefer to practice in front of the mirror from the day we get the interview mail. Try practicing as much as you can and revising all the topics that I'm going to tell in the further slides. And don't take any interview lightly. It should be a quiet place with good lighting that you have selected for the interview. With steady internet connection, the laptop with working webcam and good audio. Try to check everything prior to the interview, and mostly the interview would be through Microsoft Teams, Google Meets, or Zoom call. So check if the app is working properly. Try to print and keep the job advert and your application, even though they are not going to ask it, it's for your own use. The job advert will give an idea on the job role and what is expected from you. Uh, Read through it again and again and be thorough on that, as well as go through your own application and see what you have written while applying for this job, because you may be changing a little bit of supporting information and other answers from one job to another. So you should be very thorough on what you have written in that specific application. Dress very professionally as you will go for a face to face interview, and it also gives an impression that you are very serious about the job role. Be punctual and try to log in 10 to 15 minutes early, because this gives you your time to sort out if there are any problems in the Zoom call or the in connection. So try to log in at least 10 to 15 minutes early, and I would say be there in the waiting area of the call at least 5 minutes prior. Don't keep any books nearby to refer, but you can keep a pen and paper to jot down in case you have something specific to write down uh, during the interview. And don't try to learn anything at the last minute. So don't keep any books near to you that they can see. Keep your passport as an identity proof, as they may ask sometimes, though in my case they had never asked. Be calm and composed and polite in your answers. Smile and be confident, and try to look directly into the webcam, not into the screen of the laptop. Coming to the parts of an NHS interview, so there are various scenarios that are covered. They may cover most of them or some of them, depending on the interview panel. So be thorough on all these parts, like biographical questions, clinical scenarios, ethical scenarios, leadership, team management, or stress management kind of questions, audit, QIP, and clinical governance related questions. And there will be some final questions for us to ask to them. Prepare answers specific to your role and your level. Coming to biographical questions, the usual ones in this section are: introduce yourself, take us through your CV, tell us about yourself. So, this question is the most important one and would be invariably asked to you anyway. What I would say is, Prepare a very good introduction for yourself. Practice it in front of in the mirror many times, and you should try to cover all the important things or your achievements, your awards, and everything that you want them to definitely know in your introduction. So give a very strong introduction so that they will be already half impressed from that itself. So that if you give a very strong introduction, what I feel is half of it is already covered. Prepare very well, highlight the points that gives you an edge, and highlight your strengths. Use pattern of CAMP, that is first your clinical achievements, then your academic achievements, management and leadership roles that you have done, and your personal approach. Why do you want this job? Your aspiration? Why do you want to work with the NHS? Maybe the next question. Why this specific place and what do you know about this place? So try to research a bit about the specific place in which the hospital is as well. You can incorporate the trust values or the NHS values while answering your questions. They may sometimes ask these as well to know that you are aware of the NHS values and the trust values. And where do you see yourself in 5 years? What are your future plans? Why did you want to be an ENT surgeon or in specific to your specialty? And what all surgeries have you done independently and you are confident in? So these are the usual kind of biographical questions. Coming to the clinical scenario questions, usually you will be asked emergency patient management. You should have an ABCD approach in your answer. Relevant investigations and treatments should be covered, but don't say anything that you're not familiar with, and take a very practical approach based on your experience. Appropriate escalation plans should be mentioned wherever safe, and try to be a safe doctor rather than being an overconfident one. Answers should be in relation to the NICE guidelines or the trust guidelines, and MDD approach should be there in if relevant, and identify the red flags and act appropriately. Coming to clinical scenarios related to ENT, the usual questions that are asked are post-tonsillectomy bleed management, epistaxis management, stridor in an adult or a child. That is the most favorite question. Fest complication, airway management or acute airway, CSF leak, safeguarding, COVID-associated mucormycosis, though this is a bit less frequent question now. Also, if it is the job role related to ear or otology or head and neck, there will be questions specific to that. So prepare in that way. But these are the most common ones that are asked. There will be some ethical scenario questions as well, which should be answered keeping in mind the following criteria, like the patient safety should be your priority. Keep in mind the duty of candor, consent, confidentiality, and autonomy while answering ethical questions. There will be some leadership or team management questions like how to handle stress or pressure, what is a good team, difficult situation with a colleague, what if your colleague comes late in their shift or comes drunk in their shift, what will you do? What are your weaknesses? Um, what makes you a good team leader? Examples showing that you are a good communicator and any difficult situation that you have faced and how you managed it. So these are some of the leadership or team management questions. So another common question is what is an audit? What is a QIP? Or what does it mean by clinical governance? Have you done any audits? Was it a closed loop one? Have you published any research papers? So if you need any answers to these questions, just comment in the comment section. I'll try to make another video on that, but I'm not covering it here because it will become very lengthy, but you should be very thorough on these questions. Finally, they may ask you, do you have any questions to ask them? And this is also a part of the interview, so don't take it lightly. You can ask about the training opportunities or career progression that you can expect in that job. the research opportunities, surgeries that are usually done there, and what are the equipments available. How is a normal day in the department? And can you expect a shadowing period in case you are selected? You can ask that. Don't ever ask about the salary during the interview. And if you are selected, how quickly you can join, if you can ask that. Or sometimes, most commonly, they will ask you how quickly you can join a department in case you're selected, so that you can tell them the procedures involved in it, and your notice period and things like that there. Always ask for a feedback even if you're not selected after the interview. So write a mail to the HR or the consultant, whoever is sending you the link, or sending you the result of the interview, and try to ask them the feedback, like why you were not selected, so that you can improve on your next interview. Coming to a book recommendation, this is a medical interviews book that was available in Amazon that I have bought for my interviews. But it's not necessary for you to have a book, but this was very helpful on how to approach an NHS interview. There were loads of questions, even though I haven't gone through all. A few of them, whichever I had doubt, I referred this book. So it was very helpful, and I think it is helpful for everyone who's looking for a NHS interview, even if it is in a junior role or a senior role. I'll put the link to these books in the description box if you want to check out. But even if you don't buy this book, I think this video has covered most of the questions that you can expect. But if you want an additional support, you can definitely buy this. You can expect the results within 2 to 3 weeks of the interview, usually. Sometimes it may be less or more than that. To make sure, you can even ask the interview panel directly during the last part of the interview on when you can expect the results, or you can mail the HR. Another important thing I want to add on is to contact as many people in the hospital as possible once you get the interview mail, to make sure how the department is, how the place is. So I usually use the LinkedIn or Facebook to contact people working in the hospital to get an idea, and this has been very helpful in my case. So thank you. I hope this video was very helpful for you for your interview. And if there were any additional questions that you had in your interviews, please add it on to the comment section so that it would be helpful for others as well as for me. And if you want me to cover any specific topics in future, please add it on to the comment section. And if this video was helpful for you, I think you can check out this video on that I have made on the salaries in the NHS. And see you soon. Bye bye.